welcome back. So Danya here. Today we are with a new video. It's all about ICD-10-CM guidelines, chapter 1. So in the previous video, I have added all the basics which you should be thorough when you are preparing for your ICD-10-CM guidelines. From today onwards, we will be completely discussing about all the chapters day by day. Okay. So today we will be saying about chapter 1, that is certain infectious and parasitic diseases. The code series A00-B99, U07.1. It's all about COVID. Okay. So in this chapter 1, we will be discussing about two guidelines. That one is HIV and second one is sepsis. So HIV and sepsis all together we cannot discuss in the single video. So for sepsis alone, I'll be adding a separate one. Today we will be completely discussing about HIV guidelines. Okay. So in this so before discussing this video, if you're watching my channel for the first time, please do subscribe, and if you find it useful, you can share it with your friends also. So before starting the video, please take a notebook and a pen. So write down all the guidelines which we are discussing today, and once the video is completed, please revise all those guidelines and make sure you have understood all the guidelines. And if you have any queries, you can ping me in WhatsApp or else you can mail me also. So I'll give you a clarification based on that. And if you need practice scenarios to practice those questions by implementing this guideline, for that also you can mail me. I'll share you few questions for your understanding. So this is all about today's content. Okay. So if you're watching my channel for the first time, please do subscribe. Okay. So today we will be discussing about HIV guidelines, and I have added a PPT here. So don't skip the video in between. Understand and read each point which is given inside the PPT guidelines. Okay. So we'll discuss with that, and hereby I am pausing my video. So we'll continue with the PPT. Thank you so much. So we are starting with chapter 1, certain infectious and parasitic diseases, code series A00-B99, U07.1 and U09.9. Okay. So in this chapter mainly we will be dealing with HIV guidelines as well as sepsis guidelines. So in this complete video we will be seeing about HIV guidelines. Okay. First we will see HIV guidelines. First one is code only confirmed cases. In case if you are confirmed that the patient is diagnosed with HIV or the patient is infected with HIV, the primary code will always be for HIV, that is B20. Next one, patient admitted for HIV-related condition. HIV-related condition means what? Because of HIV, the patient has got some disease condition. So primary code will be for HIV and second code will be for HIV-related condition. Next one, patient with HIV admitted for unrelated condition. Unrelated conditions are fracture, burns, neoplasm, heart conditions, etc. So in this case, unrelated condition should be the primary diagnosis and HIV should be the secondary diagnosis. Next one, asymptomatic HIV. Asymptomatic means what? Absence of symptoms. Okay. In this case, asymptomatic HIV is otherwise known as being HIV positive, known HIV, HIV test positive or positive HIV test. Any of these words can be used to mention like it is asymptomatic. In asymptomatic, we will be coding Z21. Next one is patient with inconclusive HIV serology. Serology means blood test. Inconclusive means we cannot predict whether it is positive or negative. The result is not yet confirmed. In that case, for inconclusive HIV serology, we will be coding R75. Next guideline is HIV infection in pregnancy. So first we will be coding for HIV infection complicating pregnancy O98.7- and second we will be coding for HIV condition, that is B20, and third for gestational weeks Z3A.-. So that's all about HIV infection in pregnancy. Next is encounter for HIV screening. Screening is otherwise called as testing. If the patient is coming to the hospital for testing whether he is positive or negative for HIV, the primary code will be for Z11.4, and second code, if the patient is taking HIV-related counseling, the second code should be for HIV counseling Z71.7. Third, if there is any lifestyle related problems, that should be coded as third. And HIV counseling and screening, for that the code is Z11.4. First is for encounter for screening, and second you are coding for counseling, that is Z71.7. and next, if there is screening due to high risk behavior, in that case first code for screening is Z11.4 and second code for problem related to lifestyle, that is Z72.89. Next one, HIV infection managed by antiretroviral medication. Antiretroviral medication is a drug therapy which is given for HIV patients. In this case, first we should code for HIV. Second, you should code for long-term therapy for this antiretroviral medication is at 79.899. So that's all about HIV infection. Next, for antiretroviral medication for symptomatic as well as for asymptomatic, I have added an example. You can go through it and you can understand. Like for symptomatic, the primary code will be B20, and for asymptomatic is at 21, and for drug therapy the second code will be Z79.899 for both of the conditions. Okay. So next is encounter for HIV prophylaxis measure, that is when the patient is seen for the administration of pre-exposure prophylaxis medication, you will be coding Z29.81. So pre-exposure prophylaxis is mainly to prevent the infection. People who are at risk for getting HIV through sex work or through injection or drug use. That's all about encounter for HIV prophylaxis measure. And finally, infectious agent. For infectious agent, we have three types of organism, that is B95, B96 or B97. 95 is for streptococcus, staphylococcus and enterococcus. 96 is for bacteria and 97 is for virus. So always this B95, B96, B97 will be the secondary code. It will be never used as a primary code. So that's all. Next is infection resistant to antibiotics. So infection resistant to antibiotics, primary code should be always for the infection, and secondary code should be for the resistant of that drug. Hereby I have listed antibiotic resistant, that is penicillin, methicillin, like that drugs are given. So that based on this you can choose the resistant drug and give the code. Examples are given here. For example, wound infection resistant to multiple antibiotics. In this case, first you have to code for the infection following a procedure. Second, you have to code for the organism. Third, you have to code for resistant to multiple antibiotics, that is Z16.24. So this is an example which is given for resistance to antibiotics. So that's all about HIV guidelines, and in the next video we will be seeing about sepsis guidelines. Thank you so much for watching. If you haven't subscribed, please do subscribe and share it with your friends also. If you need practice scenario questions, you can mail me or you can just ping me in the WhatsApp so that I can give you a few questions which you can practice also. Thank you so much. Please wait for the next video so that you will get a continuation of sepsis guidelines. Thank you. Take care. Bye bye.